like that.
Yeah.
And that gets your muscle tired and depresses the nerves.
Okay.
And that's what causes the pain. Now let me show you the other picture so you can film that. This is a little damage that you have in your L4 to L5 disc.
Oh no.
You see these discs?
Yeah.
As they go down, further down the back, they're thicker. They should be thicker. See, they're thin here and it gets thicker.
Yeah.
And look at this one, really nice, but this one's thin.
Oh.
And this one is not that good either. These last two discs are beginning to erode, a desgastarse.
Wow.
And that doesn't hurt, but you have to understand there's no replacement, and that disc has to last you until you're 105. Really, there's no replacement. And so that doesn't hurt, but I like to explain it. What causes that is the deviation and people that take pain medication.
Oh, really?
Yeah, because you'll feel better. You don't take it, I know, but other people do. They feel better and then they move more, and it gets even more damaged.
Yeah.
So you're doing a great job not to take it.
So I can feel the pain or something? Is that what you mean? Or?
Yeah, because if you don't feel the pain, you'll play sports and do anything, and you'll rip it even more. The disc will get degenerated even faster because you don't feel the pain.
Yeah.
See, pain is the alarm. It's not the problem. The problem is you have the deviation.
You want me to record you, or I don't know?
Huh?
You want me to record you a little bit, or?
No, yeah, fine, whatever. But that's what you have. You understand?
Yeah.
So when we correct the deviation, that stops eroding.
Okay.
But if you stay that way, it gets worse. Even if you don't take pain medications, just the fact that you're a little bit like this, I compare it, which sounds dumb, but it's true. It's like a misaligned car, right? If it's not aligned, the tires get worn out.
Yeah.
That's what's happening to your disc because your weight is to the side. So when we correct the deviation, the damage stops. It doesn't grow back, but it doesn't advance.
Sounds good. Sounds good. Yeah.
Yeah. And that's what you have. Here's from the front, from the back. Front.
So I got a whole bunch of gas, huh?
Yeah, it's normal. But sometimes when you have back issues, low back issues, you tend to have more gas. But it's normal. It's not a problem, you know.
Yeah.
But when you start getting better, maybe you'll feel a little less gas later on. Any questions?
Does that gas go anywhere? Is that hiccups or?
Yeah. Hiccups or go to the bathroom, whatever, you know.
Oh, okay.
Or something you ate. It's just your intestines. It's normal. So any questions?
Nope. You see my heart there? No, right? Because it's soft.
No. It's up there. Further up. Any questions about the X-ray?
No, I mean.
So that's what we do. We see about 200 patients a day, even 5-year-olds and up.
Yeah.
And what we do is correct it. It's a short treatment. It's I like to recommend when there's issues like this. It's very short, 13 visits, once or twice a week. One visit is the adjustment, and one visit is the therapy. You should be fine, and then after that, try to come once every 6 months for maintenance, because your discs are already getting damaged. And so if you wait for pain to come back again, maybe in 2-3 years, your disc is even worse, you know, because you've had a deviation without even feeling pain. So this is like going to your dentist or getting maintenance on your car. It's like every 6 months, get seen one time.
Yeah.
Or else it'll happen again.
Oh wow. Yeah, so I could keep the bones in place and stuff like that.
Yeah, so it doesn't decrease the disc space anymore. Because remember, there's no replacement for that. The price is the other famous thing here. We see a lot of people that come by bus. I saw an 18-year-old girl this morning. In other words, people could afford it here due to the price, because this is expensive. My friends, a lot of them charge about $200 per visit, you know?
Yeah.
This is expensive. So what we do here is we give 2 options. The $37 option, which is what everybody does, and the old price, which I don't recommend anymore, $60. But our famous thing here is that we've never charged more, like my friends, close to $200. That's pretty expensive. So the $60 option, which I don't recommend anymore, it's our old price. It's if the person pays every time they come, right? Like most doctors do. But I didn't like that because people have, when they start getting better, they start missing their appointments because people have.
You feel better.
Yeah, and they don't have money left over, and they just stop coming, and the problem is still there. And it's called patient compliance. So I made something up a few years ago, which is what everybody does, even people that come by bus. I bring the price down from 60 to 37 and change. The treatment's the same, but the price goes down a lot in that option, so the person prepays it. So they pay it all in one shot.
Yeah, it's like a whole bunch of visits.
At once, 13 visits. It comes out to $490. It's a month and a half. So it comes out to 37 per visit, but it's paid in one shot. And that helps the patient not miss their appointments because it's already paid.
Yeah.
They stop that little game of, ahoritica no tengo el dinero. The famous, right now I don't have the money. Like if there's another now that they have money, there's never money left over. So here it doesn't happen because the person already paid it.
Yeah.
And it makes him pull their ear and makes him come. And in this case, and like I said, we see a lot of people here a day, it's something that you need to do, not because the pain is killing you, because your discs are being damaged.
Yeah.
And there's no replacement for that. Any questions about that? And we'll start today with the adjustment, but I just wanted to show you the x-rays and...
I want to show, so I should be sitting up like this, or...
No, normal. I mean, there's thousands of things you can do, but the main thing is to correct that, because if you sit down correctly with this, it'll hurt you.
Wow.
Because you're going against the...
Oh, yeah.
So I have older people that they ask me, why do I drive now like a gangster, sideways? I go, no, it's because your body's throwing you that way. If you were to sit up straight because somebody's watching you, you'll hurt yourself.
Wow.
Yeah, so it's not a postural thing. That'll get better by itself when it's corrected.
Okay.
Question? And we can get started today. We'll get started with the adjustment today. Any questions about the x-ray, the treatment? Man.
Nope, I mean...
You'll feel better today.
I mean, I have been going to like another chiropractor. Or what if I do both?
You should.
Right.
When's the last time you were there? The last one?
I don't know. Not that long ago, maybe a week or two.
Okay, well, we'll do the adjustment today. It's the doctor and myself, we're two doctors, and she's great.
Yeah.
So what you should do, my advice is, give us, you'll try it here, and then you'll compare it, and then here, remember, where you go, you don't do therapy. It's just adjustment, right?
Yeah.
Yeah, like my friends do. That takes a lot longer. We do adjustment and therapy, remember. One visit adjustment, one is therapy. And that makes a difference. That's why people get better fast. If we were to do just adjustment, it would be like 20-something visits. A lot of visits. So here it's little because of the therapy, one visit, the adjustment is the other.
Okay.
Any questions about the price, on the pricing? Any question?
No, I mean, it's, fair.
You want to do the prepaid?
Yeah.
And that includes everything. Oh, I forgot to tell you something. Two things. When you start getting better, two things. Don't abuse. That's very common. I do that. Don't exaggerate your movements. In other words, don't go to the gym all of a sudden and do a lot of stuff or run.
Should I be kicking a little bit or?
No. When you start feeling better, don't exaggerate your stuff. Don't lift heavy stuff. Don't start working harder because you'll go back.
Yeah.
Do things little by little. Don't run yet for like 2 weeks. Don't play any soccer or anything like that.
Oh, don't run?
Yeah, don't run. You could walk, but don't run. Like for 2 weeks.
Okay.
Even if you feel better, like fast, don't start doing it. And second, homework is ice. 20 minutes maximum, Jose, in your low back for 7 days in a row, starting tonight. 20 minutes. I use Ziploc bags. If you have the gel, it's good too.
Yeah.
20 minutes max, low back. And every time you leave here, and do it for 7 days. And every time you leave here, make your appointment for the next visit. And it would be great if you could come tomorrow for the therapy. Remember, 1 day adjustment, 1 therapy.
Yeah.
And you really love the therapy. It's 20 minutes to bring down the inflammation, but you're gonna feel a lot better after the adjustment today.
All right, sounds good.
All right, let's go. We could post that. People post their videos, and it's great because people hear it, and it gives us good advertising.
Yeah. Post it on YouTube.
¿Todo bien? ¿Todo bien? Do you know anybody that knows about doing things on YouTube? Like, I know, and I've done it a little bit. There's so much to learn. Do you don't have any friends that know how to do stuff on YouTube?
Not really.
Yeah, I gotta find somebody. I know friends that know Facebook and
Like
Instagram.
editing and stuff or something?
No, I know how to edit videos, just like how to do ads and stuff like that on Facebook.
Oh,
and
ads on Facebook? Oh, that's kind of easy. You just go on like Google.
yeah, I did it but a long time ago. I want somebody that knows how to do it. If you find somebody, let me know.
No,
and I will pay them.
I mean, I can help you out with that.
Yeah, we can talk about it because I did it a long time. I took a YouTube course sometime online, and I did a little bit. But there's a bunch of little things, and then you could put your videos in front of the competition.
Yeah. A little bit, yeah. I think I can figure it out. Yeah.
Yeah, you can work on it and I'll pay you. Because I would love to do it, yeah. I forgot how to do it, I don't do it anymore. And I do a lot of videos, but I do it for Facebook and Instagram. And YouTube.
Yeah, I think I saw your Instagram.
Yeah, I just need to do YouTube and start doing it, yeah. So, we'll talk about that. All right, go to the little one.
Oops, sorry.
Te faltan 3.
¿Y vienes? ¿Me lo deja afuera?
Sí, ahí están las tarjetas.